This conference will now be recorded.
Okay, I believe Joe is having some technical difficulties, so I'm going to go ahead and get started with today's webinar. And today we're going to be talking about information blocking. It is part of the 21st Century Cures Act, Section 404 to be particular. And you are going to need to get ready for a tidal wave of change. This new rule is going to really change the way we think about medical records and access to those records. For some of you, it will be a good thing. For others, it's going to be a challenge. So we'll get started here with what we have on tap. So first of all, I do want to put out the information that this is not intended to be legal advice. I am not an attorney, but we are going to be using the best information available from the different government agencies that are in charge of the 21st Century Cures Act and information blocking. This is a massive 320-page rule, and there is going to be a lot more information to come out as the effective date of April 5th comes, and we start to see more implementation and enforcement of the information blocking rules. Now, a little bit of the legislative history. So this rule came about because Congress was hearing numerous complaints that the people, the patients and other providers were having a difficult time, even with the implementation of EMR, getting medical records. So the patients weren't getting good medical records from their offices and having difficulties. Other providers and other care providers were also having difficulty. So they put together this report asked for by Congress, and after receiving it, in a very bipartisan fashion, they passed the 21st Century Cures Act. So bipartisan, we're in such a divided state here, but I want you to understand that these rules and regulations are going to go forward no matter who's in office, because this is truly something that all Congress wants to see done. And it's basically putting access and control into the hands of the patients. And the best way to describe that is that at the end of this, when it's all implemented, everybody will have access to all of their medical records from the providers, from the hospitals, from the radiology facilities and labs through an app on their mobile phone. So that's where we're heading with this. But what we're talking about today really is more of the April 5th, coming Monday, the information that you need to know for what information blocking is. Real quickly, an overview of the government agencies that are involved. Pretty much it's Health and Human Services and their sub-agencies. So the main agency in charge of rulemaking is the Office of the National Coordinator for Health IT. They're the ones that their website is a very good resource of where the information is. It is going to be the Office of the Inspector General who does the enforcement and investigates the claims of information blocking. The Office for Civil Rights, although information blocking is not HIPAA, it very much parallels HIPAA, and there are going to be cases where the Office for Civil Rights can also enforce claims. And then in limited fashion, for any Medicare fraud or waste or abuse that goes along with information blocking, CMS can also get involved with the investigations there. And I put in here the Federal Trade Commission because we've seen a tremendous increase over the past few years of FTC coming in, and even if it's a HIPAA violation, taking the lead in the investigation and enforcement, because if there's an unfair trade practice, you're violating any of these other laws, HIPAA or information blocking, they can treat that as an unfair trade practice and they can also get involved. So I do expect to see a lot of enforcement with information blocking. Again, this is a priority for the Office for the Office of the National Coordinator. So enforcement, what is that going to look like? We don't know. I can tell you there are different what we call actors. I'll go over those in the next slide, I believe. But there are different actors, and for actors that are not healthcare providers, there are civil monetary penalties, and those are defined as $1 million per violation. So this is going to be a substantial source of revenue for the government because if you are a health IT provider or app provider and you information block, the penalties are going to be very high. They have not decided on what they call, or what the law calls for, appropriate disincentives. So those have not been published yet, but we have heard very high amounts bantied about, such as disincentivizing you of all of your Medicare or Medicaid for the past year. So again, this is going to have major repercussions, so you are not going to want to be a information blocker. And unlike other rules and regulations that we're used to, the harm to the patient is not going to come into the appropriate disincentives. Harm and damages are not a requirement for you to be an information blocker. So again, to focus on the fact that this isn't just the ONC, this is all of our government really wanting interoperability and patient access. So here is an example, CMS. If you're dealing with them, you know about the FER standards that you have to have for interoperability. But basically, this statement put out by them in their fact sheet is giving patients the access to their health information when they need it most and in the way they can best use it. The OCR has been on a rampage over the last few months. This is the 17th. This was put out just a few days ago. That yesterday came out the 18th. And this is where the OCR is fining offices an average of about $65,000 each for not giving a patient their records within the HIPAA 30-day time limit. So something we've never seen before. The OCR is actively going through and making sure that the OCR is enforcing a patient's right to access their medical records in 30 days. Office of Inspector General, again, this will be the agency that will be doing the enforcement. So even with the 18th Access Initiative from the OCR, even with that in place, they pale in comparison to the enforcement of the Office of the Inspector General. The OIG is very, very active in enforcement activities. We receive 1 or 2 or sometimes even 3 of these notices every single day. And again, the OIG, not unfamiliar to large fines. We see one for 1.25 million, another for 8.8 million. So again, they are going to use the enforcement portion of this to make sure that there is absolute compliance, because to not comply is going to cost more than you can afford. So here is the Deputy National Coordinator for Health Information Technology. Power to the patient. Our records, our right, our choice. This is going to involve cultural changes in the way you release and think of the medical records that you have. Basically, HIPAA has always been you had permitted ways that you could disclose records. Under information blocking, it goes from permitted to the fact that you must share these medical records. Now, I want to get to who is an actor, who is covered under this law. And basically, if you have a patient, you are considered a healthcare provider. So this is their list of who meets that classification. So I think any of our clients definitely would be one. Now, we do have clients that do get HIPAA compliant, even though technically they fall outside of the jurisdiction for the Office for Civil Rights and HIPAA. But even if you are not a HIPAA covered entity, you are still under the information blocking a healthcare provider if you fall into one of these categories. The other actors that we're not really going to be discussing too much today, other than how they peripherally come in, are health IT developers of certified health IT. In other words, those companies that want to develop an application that will connect to one of the health information exchanges, the other actors. They have to go through a process to be certified by the ONC, and then once they do that, they will be able to connect to these health information networks that will give patients full access to all the medical records, which means eventually, and more than likely sooner rather than later, you will be asked to join a health information network, and if you don't, you will be guilty of information blocking. So some of the definitions that we need to review. Well, the definitions in the 21st Century Cures Act. EHI, so it's not protected health information. It's not the HIPAA definition of PHI, protected health information. It's a subset for the first 2 years. And we'll go through that in the next slide, but electronic health information. So this law only really concerns your electronic health records. Now the access exchange is what we expect them to be, that we have to access and exchange the information, and it has to be provided in a useful manner. Again, the goal of these regulations is to give the patient more access and control over their health information. So what is it that is covered for the first 2 years? It's called the US CDI, and it's version 1. That is the US core data for interoperability. If you'll look to the right, you'll see basically the assessment plan, care team members, goals, health concerns, problems, procedures. Pretty much everything but billing records is really in this definition of EHI for the first 2 years. After the first 2 years, it expands to the full definition of protected health information, the same as HIPAA. Now, just because of this new information rule doesn't mean that patients still cannot use their HIPAA rights for anything that falls out of the US CDI. There you have 30 days. I do want to tell you, and we're going to be putting out another email blast on the proposed rule. We really think that as a healthcare provider, you need to get involved and put in some comments to these proposed changes. Some of them are probably good that you'll like, but others, you're definitely going to want to put in a comment that this isn't going to help healthcare. But one of the proposed rules that I do believe will go into effect is the 30-day time limit that HIPAA gives you now will be taken back to only 15 days. But again, that's for HIPAA, and today we're talking about information blocking. So I do want to also remind you, and this is a problem we continue to have with some healthcare providers. If you have psychotherapy notes, those notes designed as the notes taken by a counselor during a counseling session, those are exempt. The only way that those notes can be released is if the patient signs an authorization and they're going to another mental health care provider. They are not allowed to go to the patient or anyone else. However, and this is the big question here, do you maintain them separate from the other medical record? Because they only have their HIPAA protections if they are kept separate. So you must keep those records separate. I recommend that if you don't have a way to keep them separate in the EHR, you only keep those in paper and you keep those in paper records. Otherwise, you open yourself up to lawsuits and other actions because they've been mixed in with the designated record set, which means they no longer have their HIPAA protections. Also, any information compiled in reasonable anticipation of a civil or criminal proceeding, those records are exempt as well. So what is information blocking going about? It's basically interference. That's the key word here, except for as required by law or an exception. So we do still have to follow the law, and it's not even going to interfere, but is likely to interfere with the access, exchange, or use of EHI. And understand here that a delay, charging a fee for access to the portal could be considered interference. And in their information here, I wanted to point this out. We interpret interference broadly and to take many forms. So again, this is something that has a very broad definition, and we'll be going through that. So again, substantial cultural and operational changes for nearly all EHI requests, from whether it's from the patient or from another provider, must be responded to. Unless there's an appropriate exemption, we're going to go through the 8 that have been identified by the law, or there is a state or federal law that prevents it. So if you prevent, materially discourage, that's a pretty broad term, or otherwise inhibit the release of medical records, you could be guilty and investigated for information blocking. A delay is each delay is going to be really reviewed on a case-by-case review, and it's going to be fact-based. Here's the bad news. Just like with HIPAA, if you are accused, it is your burden of proof. So basically, you are guilty until you can prove yourself innocent. And we're going to talk about how you can do that today. So with the ONC Cures Act final rule, there are legal elements that must be in place before they can bring an action against you for information blocking. So you must be an actor. So if you're a healthcare provider, you've got a patient, we're going to meet that one. Now, the next one is knowledge. And this is our third webinar, and we've had less than 50 people attend these webinars. To be honest with you, we should have had 20,000 because this is something, again, that takes effect April 5th, just coming up Monday. And so maybe you might get a free pass because you didn't have knowledge. There's going to be a lot of people out there that don't know about this. So you might get one free pass, but that's going to be it because knowledge is required as a healthcare provider. The intent, and again, this is very broad, but any practice that is unreasonable and again is likely to interfere meets the intent category, has to be part of that EHI that I just showed you, and it cannot, you cannot, be required to violate the law. And again, it doesn't meet any of the 8 exemptions. And again, we're going to go over those at the end. Now, so what are examples or what are some of the definitions in the rules for information blocking? Well, practices that restrict the access, use, or exchange of the information. So if you've got practices that cause delays or keeps other providers or patients from getting their information, those practices are going to be information blocking. Implementing your health IT in a non-standard manner. That's really more for the other actors, the app providers, and for the networks. They also have to exchange information with each other. So that's kind of what that's in there for. Here's a big one, limiting or restricting the interoperability of health IT. You have a portal. You most likely have gone through and said, we want the patients to get their progress notes. They can schedule appointments, but that's all we're going to give them access to. You have just limited or restricted the portal's access to patient records that patients could use. You are guilty of information blocking. I think that one's going to be quite simple, and we're going to talk a little bit more about that with some of the examples put out by the ONC. Acts that lead to fraud, waste, or abuse, or otherwise impede the innovations and advancements in health IT. That's where CMS can come in and do enforcement from their end because that's considered Medicare fraud or waste or abuse. And then any restrictions. And these restrictions you may not even be aware of. They may be in your business associate agreements or the underlying service agreements with your business associates. You're going to have to review all of those to make sure that there are not any restrictions in those documents. So you can have formal restrictions. So formal restrictions would be an example of a policies restriction where the staff requires that, and I have a lot of offices that do this right now, you have to come in and sign an authorization before we're going to release your medical records. If it's permitted under law and you have a policy that requires that additional step, you are going to be an information blocker. Patient comes to you and asks you for their medical records. Again, we talked a lot about EHI and it being the portal, but patient comes to you and says, I want information on paper, and you say, nope, the only way we provide them is on a CD, and that's an inusable format for that patient. That's also information blocking. Again, disabling the interoperability, not using your portal to the fullest extent that it can be used. And here is where everything really comes down to isolated inferences. A physician has the capability to provide same-day EHI access through the portal in a format requested by an unaffiliated provider or the patient, but takes days to respond. So whereas have always been used to that 30 days that HIPAA allows, I know most of our practices do it much, much faster, but now the inference is not same day, The inference is not in 2 days. The inference is immediate access of electronic health information. So inherently suspect activities, any interference with the patient seeking access to their own records, or again, those other providers seeking medical records for treatment or other healthcare operations. We just had a case yesterday where an office called and said they don't want to give access to their ACO and just give them full access to their EMR. But now, as of April 5th, that could be considered healthcare information blocking because of the fact that you have the availability, it's for healthcare operations, and you interfered with that process. So some other examples of information blocking. Again, office policies that are more restrictive than HIPAA. HIPAA allows patients to be identified over the phone and be verified, but if you require them to come in and sign an authorization, that is more restrictive than HIPAA requires. You are guilty of information blocking. Creating any other hurdles or accesses to exchanging or EHI. Misunderstanding the law. So you claim a HIPAA restriction that actually doesn't exist, such as, again, having that authorization form. Well, we can't do it because HIPAA requires us to have that. No, it is a permitted disclosure to provide records for continuity of care. So misunderstanding the law would lead to an information blocking claim. Slowing or delaying, taking more than a day after the records have been requested. So you cannot withhold medical records or laboratory results or pathology reports until they've been reviewed by the office. That is now information blocking. They're very, very specific on that. And if you withhold putting information into the EHR as quickly as you can, that also, again, would keep it out of the EHI access. So it would be information blocking. Here's the really bad news. ONC will not tell you in advance, so you can't say, hey, I'm doing this. Is this am I information blocking? They're not going to do it that way. You're going to have to actually go through an actual investigation before they can tell you whether or not you're information blocking. So a lot of information is going to be learned as this law actually gets put into effect, but I expect it to be very broadly and very actively enforced. So applying timeframes that, again, of other laws. So again, the HIPAA law says 30 days. Now, information blocking basically says immediate. Another big cultural shift, again, from permitted disclosures under HIPAA to our directive and required. So you must, again, make sure that your information is shared between patients and other providers requesting the information. So for some of you, you do that, you do a good job of it, and one of your biggest problems is getting records from the other providers. Those are going to go away because they're going to be fined excessively to show that, delaying of records is not going to be tolerated. Now, here's another one. I had a practice that told me the other day, well, before the patient gets any records, if they request them, the physician wants to review them before release. Maybe they're fearing a lawsuit, or maybe they just want to double check everything before the patient gets it. That is information blocking. So the records need to be available immediately. In fact, one of the things I was reading just last night on this is that even if they have not been signed off by the physician, if they are used in that patient's care, they would have to be released. So this is going to be another challenge and burden that now, even before records are signed off on and maybe even reviewed by the physician, they are part of the EHI that has to be immediately available. Test results, again, if requested, as soon as they're available to you. So we're going to go through an FAQ that they answer that basically said, do you have to proactively send information to the portal? Well, if it was requested, even though they say no, you do not have to proactively do it, the results do need to be there as soon as you receive them. So proactively is really the only way I can see to do it. Again, you cannot omit any information. That would be information blocking as well. And again, make sure you've got the technology to complete this. Since the major fines are aimed at your EHR companies, I do suspect that if they don't have it already up to date, they are working feverishly to get this in place so that they are not accused of information blocking. Other examples, if you have the capability but are not doing it. So you've got a portal, but you've not turned it on or you've not activated it, that would be information blocking. When you get these requests, again, I don't know of any of them that are out there, especially in the greater Florida area right now, but when you get these requests, you are going to have to review them. If they don't meet any of the exemptions, you are going to have to contract with them. Even though that may cost your practice and not even be used by your patients, you are going to have to be part of these new networks. Again, contractual restrictions. You have to go through your business associate agreements. So here's an example. You have a billing company, and if in the agreement it says if the patient or your office needs billing information, they have 3 days to respond to that request. That is now information blocking because that could be information, if it's part of the EHI, it wouldn't probably be in the first 2 years, but after that, that would be. But if you have any other contracts that restrict when you can get information that you otherwise don't have access to, that's part of the designated record set, that would be information blocking. So basically share the information unless you have a good reason not to, and if you do have that good reason not to, you need to document it. We'll be talking more about that here in just a little bit. So some of the challenges, some of the things that have already come up and we see as being potential impediments to following the information blocking rule. So for pediatrics, if you have a patient privacy request from the personal representative or parent of that patient, and say it's on a 16-year-old who has asked for the state law and for their information not to go to their parents or their personal representative, it's dealing with their sexual health, then the patient privacy request is allowed by law. So they're allowed to implement that. But how do you segment it? So if the personal representative gets access to the patient's portal, that information's in there. So how do you separate that? That's one of the challenges that's going to have to be addressed here. Again, all of your contracts, your business associate agreements, and the underlying service agreements need to make sure that there is no instance where you will not be able to get immediate access to that patient information if needed. Scanned records are going to be another challenge because a lot of EMRs do not have a method for scanned records to go into that patient portal. And if they meet the definition of EHI, they need to be made available. Labs, pathology reports, imaging reports, immediate reporting. And so here's something that, really goes against good healthcare. If the patient's pathology report comes back stating that the patient has cancer, they're going to have the opportunity to see it and review it in many cases, long before you get a chance to see it and review it. What about HIPAA allows, so the law allows for told-in confidentiality. So so a patient has a family member that comes and gives you information on that patient. They asked that they did not want the patient to know, so they asked for that to be in confidentiality, but it's in your notes. If you give that patient access to their portal, are you going to be able to restrict that information? So again, other challenges that you're going to have as you're implementing the information blocking rules. So here is an FAQ, request for information, done by the Office of the National Coordinator. And do the information blocking regulations require actors, you as a healthcare professional, to proactively make available the EHI, the electronic health information, to the patient portal? And their answer is no. But they go on to say if the delay were to constitute an interference, then that delay could be considered information blocking. Now, to further go on, they added additional information to that FAQ. And this was a report that I just pulled off by the ACR, the American College of Radiology, that basically, in their further explanation, the Office of the National Coordinator said that if a patient goes to the portal and queries or looks for that information and it's not there, that's going to be considered information blocking. So my point here is that you are going to have to make all the information proactively available to the portal. You're going to have to push everything there. And this was the actual information on their FAQ. To further illustrate, it would also be considered likely to be considered an interference where a delay in providing access, exchange, or use occurs after a patient logs into the patient portal to access EHI, and such EHI is not available for any period of time through the portal. So throw out any notions of not pushing everything to the portal, even though they said you don't have to. They further go on to explain it would be information blocking not to. So there are exemptions other than violations of state law. So the state law, a good example of that was the minor wanting to use the law that Florida provides to withhold sexual information from the parent or personal representative. But there are other exemptions that were identified that you can document and would also be a reason for not giving immediate or denying access to the patient. Now, all of these exemptions that we're going to go through must be reasonable and necessary and address a significant risk. So you have to apply them on a case-by-case manner. There's not going to be any general broad policy, and it must be documented. If you deny a patient, we must send them a response within 10 days. So here are the exemptions to the definition of information blocking. Preventing harm exemption. This is the exact exemption as in HIPAA. So if there is a likelihood that releasing these records to the patient or other persons with the ability to request that patient's information, and you feel it would cause the patient to harm themselves or to harm another person, then you have a right under the exemptions here to prevent harm and not release those records. But again, you would have to send that patient a letter telling them why. The next one is a privacy exemption. So if the information that would be disclosed would lead to a privacy rule, again, going back to our pediatric patient, they ask for that privacy restriction. You can apply that here as well. Security. So you're going to have these ONC certified applications and networks coming to you. You still want to check out the security, because if you don't feel they have the proper security, or your IT department feels that them connecting to your network is going to create a security exception, we can do that. I don't think that's going to be available for broad use, because once they're certified by the ONC, it's going to be assumed by the government that they are going to be a secure provider. And so you're going to have to interact with them unless there are other security concerns that you and your IT staff can identify. The content and manner exemption. So we've been talking again mainly about the portal access to EHI, but patients under information blocking can also ask for their records in paper or on CD or on a thumb drive. But if you don't have that capability, so they want their records burned to a CD, you do not have the capability to do that, then you have a content and manner exemption. You must work with the patient. Well, we can't, we don't have a CD burner, and we're don't feel the need to go out and purchase one, but we can put your records on a thumb drive, and here's the charge for that. Or we can push them to the portal. So basically, you have to negotiate with the patient on a content and manner that is acceptable. And if all other negotiations fail, then you want to go back to paper. Okay, they also put in here a health IT performance exemption. This is a very narrow one. This basically says our portal is down for scheduled and routine maintenance, and you're not going to be guilty of information blocking because your system was going under maintenance. So, but you can't be on maintenance 24/7 or an extended period of time without there being a good reason to. And feasibility, again, the patient requested it on a CD, and we don't have a CD burner, so we're going to use the infeasibility. But again, we're going to fall back to that content and manner and figure out another way to get the patient those records. The fees exemption and the licensing exemption. So These are two really more designed for the other actors, the certified ONC API developers, and for the networks. They can't not exchange information with each other based on licensing and fees unless the other organization is asking for all of their code on how they did their product. So that wouldn't be allowed. Okay, so getting ready. Well, Mickey Tirapathy, he is the ONC chief. They just had their annual conference. It was a virtual conference this Monday and Tuesday. So we, of course, attended that. And the most meaningful and remembering thing that I had from him was interoperability is a priority, which will require operational changes in how information is shared. So basically, he was talking about how this is really going to be, at least for all the HHS health agencies, this is going to be a priority. And the suggestions that they listed were, first of all, to update your risk analysis. We have updated our risk analysis that we do for you as a client to make sure that it includes the sections necessary to address information blocking. So as we do this year's, that will be incorporated. Review your current policies and procedures. We will be sending out to all of our clients updated policies and procedures where HIPAA and information blocking connect. We're going to be updating so that you will have current policies and procedures for HIPAA that meet these new requirements. You need to review all of your business associate agreements and underlying service agreements to make sure that there's no information going on there, and make sure that your EHR follows these new interoperability rules. Again, they are the ones that are really going to have the brunt of the fines. So I expect that, again, if they are not currently able to give out all the information, they will soon be able to do that. So it's going to be very easy for patients and providers to report information blocking. You'll just go to this page of the ONC, report information blocking. It'll walk you through, ask you a few questions. You hit create, and now you have reported somebody for information blocking. So it's going to be a very quick and easy process. The biggest thing right now, though, is again, from at least from the attendance of our webinars, there's not a lot of people out there really even paying attention to this yet. Because of COVID, it's really snuck in. And again, in their conference, they admitted this isn't the best time to be putting in such a major piece of legislation because of COVID, and you've got those concerns. But interoperability is so important that we're going to go ahead and implement it anyway. So don't expect any grace period or others, because they have been working on this solution for at least a decade, and this is it coming to fruition for you as a healthcare provider. So we have put together the information blocking compliance kit. Again, documentation, just like with HIPAA, is your key to compliance. Our kit will have a full action plan, full set of policies and procedures, again, outside of HIPAA, but specifically for information blocking. We've been building those, and believe me, they are very detailed. So you're definitely going to want to have these because there's just an awful lot of information. There are forms that you have to have. Anytime you do an exemption, there must be a form that must be documented with the specific information. Again, no policy can be restrictive. It has to be a case-by-case basis. Response letters, you're going to have those ready because within 10 days of the request, if there's a denial, we've got to send that to them. We're going to be putting together training and education. Your staff is going to need to be educated, but not really go through a long training process. As the person implementing it, the management, we're going to have a very detailed but put into small, easy to take sections so that you can get the information you need in a easy and understandable manner. Of course, support will be part of it as well, and updates, we expect them to be coming out literally probably at least monthly at the very minimum as enforcement actions take place. As we see how they're enforcing and implementing the laws, we'll be keeping everything here up to date. But to give you an example of that form, here's the exemption form for presenting harm. Everything on here pretty much in detail must be completed. so that if you have a claim of information blocking, you've got the required elements that they're going to be looking for to overcome that claim of information blocking. So I do want to open it up now to any questions. Currently, we have our HIPAA compliance kit.com, the information blocking tab. You can get the information on getting the information blocking kit, and you can also get the other information on information blocking. We are developing our site www.infoblocking.net. That will be available probably by the middle of next week. And this webinar has been recorded and will be put onto YouTube. All you have to do is search YouTube. It'll come up with the search bar for YouTube, hit HIPAA TV. And by Saturday, we should have this webinar. We highly recommend that you let other office managers and other colleagues know about this so that we can make sure that everybody knows about this and nobody is one of the enforcement actions taken against them. So I'm going to go over to the chat feature, and so if you do, I'm also going to go ahead and unmute everybody. So if you want to just talk instead, that's available. So I've unmuted everybody, and I've got one question. Will the slides be available? Yes. I actually redid them last night again through the webinars we've done. So if you'll give me about an hour, I will have the new slides up and available at HIPAAcompliancekit.com. And just go to the information blocking tab, and there will be a link to them right there. Okay, any other questions? Okay, well, if there's no other questions, I want to thank everybody for attending the webinar this morning. Again, we will be updating you with more and further information as it becomes available. And always feel free to reach out to us at our contact information. My email address here, mm for Michael McCoy at HIPAAcompliancekit.com, or call us at 813-892-4411. Again, thank you all for attending. It's been a pleasure talking with you today.